The MicroSkill we're going to demonstrate now is suturing. Now everyone's got their own preferred technique, and my personal one is to use a straight needle with a 2/0 silk. If you're more comfortable instrument tying or using a curved needle, then go ahead. But if you want to learn how to use this, let me show you the way I do it. There's two different techniques. The one that is used by standard is to put a suture on either side of the hub of the central line. What I do is to put one big suture all the way through. Let me show you the classic technique first. Positioning your line where you want it, take a relatively superficial bite of the skin with your needle. Take it out through and into the hub, pulling it through so there's a small tail left on your suture. From there, you can put your needle down and tie a knot. Repeat the same on the other side, and then you'll have your line secured. When it comes to cutting the suture, I leave about 1 centimetre clear. An alternative is to go through the hub of the central line first, and then take again a superficial bite through the skin, being careful to avoid the sharp point of your needle. You want enough tension that your line stays in, but not so much that you're pulling the skin into the plastic of the central line. That second bite of your suture is the one that locks it in place. The third one is just to make sure that it won't move. Now I've shown you the standard technique, I'm going to show you my modified technique. The reason I do it is that it produces a larger bite of tissue, so it's a stronger base for your central line to sit on, and it's also going to put less tension on the skin. I've never had a line come out, so I think it's a safe technique, but it's up to you which one you prefer. It's also quicker. So for my modified technique, take your needle, passing it backwards with the suture end attached through your dominant hand side of the central line. For me, I'm right-handed, so I'm going to put it through the right-hand side. Then lay the central line where you want it to be positioned and estimate where your needle is going to go through on the right and come out on the left. I want the suture to go through here and come out on the other side. Again, I'm taking a relatively superficial bite through and about 3 centimetres I'm going to come out on the other side. Again, avoiding the sharp point of the needle, I'll then pull some suture through and put the needle and the suture through the other side of the hub. You can see this now sits with the insertion site below one hole and the exit point below another. I can then take the loose end, tie my first knot to secure, second to set the tension on that knot, so pulling here, and a third one to make sure it won't come undone. Again, same as with any other technique, I leave about 1 centimetre of suture, so it's nice and clean. You can see here that there's a good bite of suture holding this central line in place. It's not going to go anywhere, and all of the tension of the knot and the suture is resting on the hard plastic rather than the patient's skin.